Jamil Sawalmeh is Country Director of ActionAid Palestine. He's joining us live from Ramallah. So thank you very much indeed for being with us. The United Nations saying that the worst case scenario of famine is unfolding in Gaza. What are your teams telling you?
Well, unfortunately, we have to confirm this fact because we have seen this has been accumulating for 22 months of this current war. What we are hearing from our colleagues in Gaza on the ground, as well as our local partners, that the civilian populations are now facing a dire situation when we talk about the level of malnutrition, especially for women and children who are mostly affected by this. We know by now that there is 100,000 women between pregnant and nursing women who are not able to access any sort of nutrient food. In addition, of course, to the children whom we have seen dying recently as a result of acute malnutrition, which is now quite a shocking fact that we have been seeing the build-up for this engineered starvation in Gaza. And now we have reached a critical point, unfortunately, where the civilian populations are now deprived from basic food items, in addition, of course, to any other services, including medical services, which will definitely increase the risk of a potential, mass death in Gaza, especially for children and malnourished women who are currently also struggling with continuous military attacks and continuous evacuation orders. As we know now, more than 90% of the civilian population in Gaza are living in less than 1/5 of the Gaza population, which creates also an additional challenge for the service providers such as ActionAid and other international organizations to be able to serve the civilian population. This is a reality that the world have let to happen for the past 22 months. This did not happen last week or the week before, unfortunately.
Your organization, like others, has been supplying aid and support to the Palestinian people for many, many years. Now, over the last 21 months, 60,000 people in Gaza, at least according to the Gaza Health Ministry, have been killed as a result of Israeli attacks. That's men, women and children. What's your reaction to the fact that it seems to be images of starving children that is sparking some sort of global response?
Yeah, unfortunately, it's really shocking that we had let this happen until we reach this point that we see children dying from starvation, from an engineered starvation. We know that aid is being blocked. We know that significant and enough amount of aid is actually piled up at the crossings. And unfortunately, it is quite shocking for us to see that the global community have allowed this happen gradually and slowly because of impunity and because of lack of interest in a political engagement to force Israel to abide by its obligations under international law. We cannot be surprised that this is happening. The international community cannot be surprised. We have seen that Israel has actually enjoyed the diplomatic cover from many countries in the world, and they have allowed this to happen. So unfortunately, from our point of view as ActionAid, we have been consistently calling for an additional political and diplomatic engagement to stop this from happening many months ago. So the world cannot be shocked at this point. The world has to act at this point. There has to be action, there has to be sanctions, and there has to be meaningful actions taken by the international community and the EU member states to hold Israel accountable to its obligations under international law and to be able to intervene meaningfully to save the worst from happening, to actually make sure that we don't see any additional images of women and children dying from malnutrition and starvation in Gaza.
I want to ask you about that level of intervention. We were talking to our correspondent, Hani Mahmoud, just a moment ago. He was describing to us the very limited additional aid that is getting in. Have groups like yours been given any further instruction about the provision of aid to Gaza?
Well, unfortunately, what has been entered is a small drop in an ocean of needs, and unfortunately, the announcement of the tactical pauses and the new humanitarian corridors is only deceptive when we say that aid is being transported into Gaza. We have to know how much aid is actually going to be allowed, which we haven't seen significantly improving recently. What we are now seeing that there will be some sort of mechanisms introducing some measures to transport aid into Gaza. We are not sure how is that going to be approved by the Israeli authorities or if it's going to be allowed at the scale that is needed now, because by this time we know that we need 500 to 600 trucks on a daily basis to be able to respond to the needs even before, that's the needs before the current war. So imagine at the current scale and the gravity of the humanitarian suffering in Gaza, I suppose that we need more than that. So unfortunately, we still see that, the announcement coming from the Israeli authorities around easing up access to Gaza or announcing some humanitarian corridors is only a tactic to mitigate the international pressure on Israel. And unfortunately, we have seen that the determined routes for the convoys to transport aid into Gaza are actually contaminated areas, either by looters or they are actually fall into dangerous combat zones, which constitute an additional challenge, an additional risk for us as international organizations, for our staff, and for our partners operating on the ground. So until we see that there is an immediate, complete opening, unhindered access of humanitarian aid into Gaza, and a sustainable and permanent ceasefire, I don't think any parallel or shadow mechanism will be able to respond to the needs of the civilian population in Gaza.
It's really good to get your thoughts on this, Jamil Sawalmeh, Country Director of ActionAid Palestine. Thank you very much indeed.
Thanks for having me.